My name is Linda Wong, and I'm living a happy, healthy, normal life. And no one would know, looking at me, that I was dangling on the edge of death. I mean, I remember him making rounds in the hospital to come see me after the big surgery. I heard his voice in the hall, so I didn't want to be lying in bed. So I somehow dragged myself up to standing position so that I would be standing when he came in instead of lying in a bed. And he came in with a whole entourage of young doctors behind him. And, you know, it was a very emotional connection when we see each other because we went through it together. And he stood there holding me in the hospital room, but that's how he is. He gives so much of himself in every possible way that, you know, there's no way that you wouldn't have the courage to live on with someone like that fighting for you.
There's nothing more important to success in anything anybody does, in my opinion, than working as a team.
In the very beginning, when I first introduced to a family, there's a lot of education. There's education about what the center does. There's a lot of education about whose roles are in the center.
And what that means is when the patient or their family calls on the telephone to make an appointment, they have kind and courteous people. When the patient has a problem in the middle of their treatment, people that are smart, responsive, empathic, are talking to them on the phone. Okay, and we're making those commitments. When you come here, you're going to find some of the finest people that you might meet anywhere. The characteristics that propel them into those positions are what also, in the midst of fighting a disease with a patient, gives them, I think, the extra oomph that they're going to continue to try to find a way to help that person. Draw it in from a syringe and a butterfly if you can. Okay. Take the vacuum off. And that team is, you know, the leaders of the team, but also the, you know, the supporting players who make sure that the patient gets treated well at all aspects of their illness.
What we try to do is that with every visit to really let that person or that patient know, or the guardian, what is it specifically about this person's illness and what do we think will make them better.
I remember distinctly he examined me and he said, we can do this.
We all know that, you know, diseases, sickness, the way a patient feels goes through a lot of ups and downs. But I think the personality of our team here is that we are going to find a way to solve this problem, help this person get well.